The Hell of Chronic Illness. Video by Sita Gaya. Presentation by Lola Ralston. What is chronic illness? Chronic illness is an illness that persists for longer than 3 months, in which there is no cure by vaccinations or medications. These illnesses can be managed but not cured. Examples of chronic illnesses are heart disease, diabetes, epilepsy, arthritis, and autoimmune diseases. With chronic illness, it is a world of loss. Gaya, 5 minutes, 15 seconds. About Sita Gaya, as an epileptic. Due to her epilepsy, she has seizures. The seizures lead to painful situations and other damages. One of these damages is short-term memory loss. This memory loss occurs due to numerous seizures within a short amount of time. On top of seizures, she also suffers from fatigue. Due to all this, she also suffers from anxiety and has suffered from depression in the past. Representation. Seizures. Seizures, seen them in the movies. Seizures come in different forms other than the ones commonly seen in media where an individual stiffens up and falls to the ground with convulsions. A seizure can also present in the form of an absent seizure where the individual appears to be daydreaming or spaced out. Another way a seizure can present is in the form of a focal impaired awareness seizure where an individual is doing a repetitive motion. Guy uses the example of putting things into a bag. Pain as a product. Convulsions due to seizures have led to various instances of pain for Gaya, both short-term and long-term. Some examples she gives are concussions, long-term damage from burns, extensive treatments, and dental damage, such as needing a root canal and a cap. Identity and acceptance. Acceptance is a big job of the chronically ill. Gaya, 9 minutes, 12 seconds. Chronic illness is hard to live with. When initially diagnosed, it can be difficult to accept. Those with chronic illness must find the acceptance of their own illness and what it means for them socially, physically, emotionally, and mentally. This process takes time, and some take their entire lives to find that acceptance within themselves. Those who are chronically ill tend to seek the acceptance of others as they need the social connection that humans rely on. Stigma. There are biases against dating people with chronic illnesses due to a lack of people wanting to deal with them. Those with chronic illnesses, especially ones that render them disabled, are often seen as inconvenient at best and burdens at worst. Invisibility. Chronic illnesses are often unseen. Chronic illnesses, especially those that aren't always present physically, are often unknown to those who aren't affected by them. Due to this, many people with chronic illnesses are initially judged for their laziness or incapability when it comes to everyday tasks. There are often times when those with chronic conditions want to be perceived as normal. However, because they feel embarrassed about their disabilities, they tend to mask their conditions in front of others. Resilience. Gaia's 3-point plan for resilience. Number 1, accept there is no such thing as a norm. Number 2, have empathy. And number 3, consider how chronic illness is not just a problem of the individual. My own experience. Highlighted my experience with Hashimoto's and my aunt's experience with Still's disease. Hashimoto's thyroiditis affects many factors of the body, including metabolism, hormones, and homeostasis. These lead to me experiencing fatigue, weight gain, cold intolerance, and dry skin. Still's disease is an inflammatory condition. The inflammation can lead to high fevers, joint pain, and rashes. Long-term cases can lead to arthritis and organ inflammation. My takeaway. This year, I've looked at disability through a variety of lenses due to taking a class called Beyond a Diagnosis. This class allowed me to view disability not as a burden, but as an identity and a source of community. This TED Talk led to me reviewing disability in a medical and physical context as I have in the past. This has allowed me to view disability in all forms as a person living with a chronic illness as well as someone who is going into the medical field.